Set up a scheduling template where you can see new patients in your schedule within 1 week of their phone call. Now, Naren, right there, I know there's going to be a lot of listeners that are immediately going to their calendar looking to see how far they're booked out. And they might be surprised, and doctor, if you haven't done that, let me encourage you to look at your calendar and look at when your first available new patient appointment is. If it's more than a week in the future, then you are shooting yourself in the foot when it comes to welcoming new patients into your practice. And the reason for that is in 2023, people are more impatient than ever. Naren, would you agree with me on that?
Yes, and that trend is only, getting worse. Impatience.
Our attention span is actually shortening, as a human being, rather than we're becoming more patient. And so when someone's looking for a dentist and you're presenting a new patient appointment that is more than a week out, if they found you, the way most people find a dentist today is via a Google search. If they find you by a Google search, and let's say that new patient appointment, the first available one is 3 weeks out, 4 weeks out, it's likely that that patient is simply going to hang up and go to the next dentist in their Google search. And if that's happening to you, then what you'll discover is that your marketing is actually working. And when I say that, it means you got the phone to ring.
Yes.
But your systems failed because you weren't able to accommodate that patient within a relatively short period of time. And remember, I'm not talking about an emergency visit here. I'm talking about a patient that maybe just moved to town. They're looking to establish themselves with a dentist. Nothing's going on in their mouth, but they're looking to establish themselves. By the way, if you suggest an appointment within a week and the patient says, well, right now I'm involved in a big project at work, I was kind of thinking a little bit farther down the road, that's fine. That's fine.
Right.
Push them out.
That's patient's choice, right? Yeah.
That's their choice, but we gave them an option. But if your first new patient appointment is that far out, then you're really shooting yourself in the foot. And the best way to do that is set up a block system of new patients where you put in a certain number of new patient blocks each week in your schedule. Now, every practice will have a different number of blocks depending on what their new patient flow is. But you want to block those appointments for new patients. You want to reserve, you want to put those first in your schedule. So you could go out, a good exercise to do would be to put those new patient blocks in for the rest of 2023. And while you're at it, Naren, go ahead and put them for 2024. Mm-hmm. Put those blocks in your schedule. And the goal is to release those blocks. If you can't schedule it with a new patient, then you release it with a 48-hour notice. So meaning we release it 2 days ahead, and then we can put anything, we can put the most productive thing we can put in there. So we're not going to be sitting around with open time. But now you're going to be setting yourself up for success by using a block system for your new patient appointments. Now, it might take you a little bit of while to fine tune that and to get that fully dialed in your practice, but no better time than the present to start dialing that in.